Dr. Brenda Tanyi, you are one of the lead supervisors and a panel member of the Women in Science Fund. We are glad to have you on the program.
Thank you very much.
Before we talk about the Aviva Day initiative, let's have a general picture of the Women in Science Fund.
The Women in Science Fund was developed in honor of Aviva Lilia Bernardo Kohlberg, who passed away unexpectedly at 10 months of age in November 2020. Aviva was the beloved daughter of two of our Open Dreams founders, Hans Kohlberg and Christina Bernardo Kohlberg. Sadly, the exact cause of Aviva's death is still unknown, but she appeared to have a rare disease that led her to have extreme bouts of bradycardia, which is a slow resting heart rate, as well as hypothermia, slowed breathing, and lethargy. Now, the Women in Science Fund concentrates on 4 specific initiatives. The first is the Research Scholarship, which was created in her honor to fund the training of researchers so that maternal, neonatal, and child health could be advanced and, unanticipated deaths such as hers could be prevented or at least understood. The second is a research grant, which is different from the scholarship and is suitable for short-term research projects focused on maternal and child health. So it covers 1 to 2 year-long research projects and is suitable for early and mid-career researchers and global or public health professionals based in Cameroon. There is also a need-based scholarship grant which funds the medical studies of female students inclined towards maternal and child health who cannot afford their school fees into medical school. And finally, the community health grant, which provides assistance to women in leadership roles within already established organizations, which focus on improving maternal and child health.
One of your objectives is to reduce neonatal mortality. How would you define neonatal mortality?
Very good question. So, neonatal mortality is the number of children that die under 28 days of age in a given year per 1,000 live births. So, our objectives include infant mortality as well, which is the number of children that die under 1 year of age in a given year per 1,000 live births.
Let's have the statistics of neonatal mortality in the world today.
Most recent data, according to UNICEF, states that 2.4 million children globally died in the first month of life in the year 2020. And that is approximately 6,500 neonatal deaths every day. You can imagine, with about a third of all neonatal deaths occurring within the first day after birth and close to 3/4 occurring within the first week of life.
The highest deaths of neonates occur in sub-Saharan Africa. Cameroon falls in this category. Dr. Brenda Tanyi, what really accounts for this?
There are so many varied reasons for this. Socioeconomic reasons, for example, poor access to facilities for medical attention and delivery. For example, no bad roads or costly transportation means this could lead to an inefficient pregnancy follow-up. And others like long-standing cultures or traditions and mindsets which insist on deliveries in home villages. We all know that sometimes these birth attendants will not have the basic equipment to handle the sorts of obstetric emergencies that may present themselves. So this could lead to either neonatal infections, neonatal asphyxia, or sadly neonatal deaths. Other reasons like late referrals from tertiary healthcare centers to primary healthcare centers, the existence of incompetent or clandestine medical facilities. The list is inexhaustible and goes right to issues with systems which span as wide as the lack of adequate policies put in place by governments to curb neonatal death rates. Others like the unavailability of health facilities to cater for wide ranges of neonatal emergencies, the unavailability of equipment to solve these neonatal emergencies. And then sad enough, the fact that science still needs to advance, and most importantly, health professionals still require further skills and competencies.
Before now, I listened to one of your presentations on another platform, and it was mentioned that a baby born in sub-Saharan Africa is 10 times more likely to die within the first month of life than a baby born in a high-income country. What must be done to reduce neonatal mortality in sub-Saharan Africa and Cameroon, to be precise?
I would say finding ways of addressing the aforementioned current challenges and realities, but also doing our very best to avoid the most obvious causes that are very preventable. For example, pregnant women can reduce the risks of certain birth defects by getting enough folic acid before and during pregnancy to prevent neural tube defects. Adequate prenatal care. This can ensure that full-term infants are born at a healthy weight, and so address complications like preterm birth, low birth weight, and all the negative outcomes of these. Getting proper nutrition, managing chronic health conditions, seeking help for substance use and abuse. These can help a woman achieve better health before she is pregnant, and her improved health in turn can help to reduce infant mortality risks for any babies she has in the future. Science has also brought others like newborn screening that is practiced in the Western world already, which detects hidden conditions.
The Aviva Day is here. December 17 is hours ahead. Could you paint a picture of what you would be doing in Cameroon this 2022?
Oh, yes, sure. So OD plans to visit the neonatal departments of a few hospitals in 6 towns: Bamenda, Buea, Bafoussam, Douala, Garoua, Yaoundé, to celebrate Christmas with children born with defects. The team plans to listen to presentations from health professionals who handle these delicate cases on a daily basis to get first-hand tips and strategies for avoiding preventable birth defects and mishaps as they prepare for parenthood. This is also within the context of sexual reproductive health education, which is most often kind of missing in our traditional school curriculum, as many girls end up learning a great deal about pregnancy only when they are already pregnant. The team plans to discuss the subject of research on preventing congenital anomalies. This extends to Aviva scholars who are leading the initiatives currently in the group, under the supervision of 6 experienced doctors in charge of the Women in Science Fund. I'm happily among these 6. We also plan to cover the hospital bills of some selected patients in precarious conditions like IDPs based on the amount of funds we'll have available. A whole lot of activities like hiking and other physical exercises will be carried out to promote awareness on sexual reproductive health. It's definitely going to be a fully packed day of sharing love and great cheer through community outreach.
Who can join you on the Aviva Day?
Youth-led organizations interested in reducing neonatal mortality, infant mortality, maternal mortality, and promoting the best conditions to as many lives as possible. Any person of goodwill who is ready to spread the Christmas cheer with gifts for these children who may be spending Christmas at hospital and not with the rest of their families, please feel free to join the crew. The list of hospitals shall be put up on all our Open Dream social media platforms. So Facebook, Instagram, Twitter, yes.
Dr. Brenda Tanyi, you are one of the lead supervisors and panel member of the Women in Science Fund. Thanks for speaking to the CRTV.
You are most welcome, and thanks for having me.